Hello, prospective residents. My name is Raj Nayak. I'm one of the chief residents of this year. I want to talk to you about a day in the life of a cardiology resident. What we do on the cardiology service, as many other services, we come in the morning early, we check our list, make sure we get all the new consults accounted for, and then we plan out our day from there. We go see our new patients, we then pre-round, and then when the attending comes in, we round with them about what the new cases are, and then follow-ups on the old patients that we were following from prior days. We make some medical decisions based on the data that we accumulate from our care plans and what the primary teams tell us. And throughout all of this, we get new consults coming in. We also answer to urgent matters like code STEMI calls, where emergent cases are coming from outside or other facilities. And we get to partake in a lot of procedural interventions and observe some high acuity care. Some of the cool things we get to do on a daily basis are cardiac diagnostic workups, 12-lead ECG analysis, echo labs, readings where we learn how to read echoes. We do some other cardiac risk stratifications like pharmacological and nuclear stress testing, and we even get to observe and participate in cardiac cath lab cases. Overall, we have as a primary PCI center, we get to see a lot of interesting cases come in, and we transfer out only the very few select things that we cannot handle here. What I like about our cardiology service is that you're not really working with fellows, you're working with the attending directly, and they come from a lot of highly expertise backgrounds, and they are really willing to teach and have you get your hands dirty and run the service with them. And that applies to a lot of our other programs here as well for the other services. If you're on any of the consulting services, you're generally working with the attending directly. There aren't too many fellows coming in, if at all, so you have direct access, and you're working with a broadly diverse population with a lot of interesting pathology and comorbid conditions, and reconciling all that is what makes all of us really good internists, and even for those with fellowship ambitions, very well prepared for the next step beyond.
Everybody, my name is Zainab. I am a PGY1 here at University of Maryland Capital Regional Medical Center, and I want to introduce you guys to our program. I want to talk a little bit about it, and I hope this is somewhere you guys choose to go to. So right now, I'm actually rotating in a GI subspecialty, which is a unique thing that our program can do. As first years, we get to rotate in a lot of different subspecialties. I've already rotated in infectious disease, I'm rotating in gastroenterology, and some of my peers are even rotating in nephrology, neurology, even hematology. So that's a really unique thing about our program, because it really helps you to kind of figure out what your interests are very early on. Like, I didn't think ID was even that interesting, but now that I rotated in it already, it's something that's like on my radar for next year. So I think that's one of the really nice things about our program. Right now I'm in GI, and I'm working with Dr. Majoub, and he's actually really great. He does a lot of specialty procedures that people come from all over the country for. So right now we had a patient that came in this morning all the way from Pennsylvania, and it's an opportunity that's like really unique and something that you might not even know when you apply to our program, but once you start working with the physicians here, it's like they really care about your learning. They really involve you in what they're doing. I was rotating with him. We were in the scope room together. He showed us all the things on the imaging. He would even label things. He would talk about it. He's set up presentations for us just to teach us between me and my two students. So there's a lot of autonomy in being able to learn directly from the attendings. And I'm rotating without a senior right now, so I have a lot of freedom in that way to like ask questions directly, and I have like direct access to him, and I think that's something that's really nice in like a subspecialty rotation. I did clinic as well. That was me like 2 weeks ago, and we have a really nice 4+2 schedule here. So I was like 4 weeks on floors. I had clinic for 2 weeks, and clinic was really great because we have like the pods outside. We have like 2 seniors, it's 3 of us residents, so we have a lot of support, and you get a really good exposure to like outpatient medicine. We have 2 attendings that are there. They're literally there with us from like 8 a.m. to 4 p.m. Ask them anything you want. Their room is right down the hall. And the patients here are really nice, and they've actually been following with us for a long time, so they even recognize my co-residents. So there's a lot of good things about this program, and I'm just talking about the outpatient aspect. And the inpatient is something that's like really great as well, which I'm sure like my other co-residents will cover. But I'd love to have you guys here, and I hope I can meet you in person. I'll be here at PGY2. I'll be here for another 2 years, and there's a lot of great opportunities, and I'm excited to meet everybody who applies.
It's Oya Khan. I'm at the PGY3 here. I'm going to be talking about a day in the life of an internal medicine doctor here. So you first come at 7 a.m. in the morning. You see any overnight patients that come in, and then you go to your unit. So there's 3 different teams here, and each team has a separate floor that they cover in unit. So it's really nice. Everything is geographic. And then once you come in, you round on your patients in the morning, pre-round, you look at the labs, communicate with the nurses, and then you round the attending around 9 to 12. You do teaching and interdisciplinary rounds, yes, that's the name of it. And you go to lecture from 12 to 1, which is protected time. And then from 1 to 4, you follow up on discharges, labs, imagings, whatever it is, communicate with the nurses. And then you sign out at 4. If you're not on call, you sign out at 7.
Hi everyone, my name is Micah. I'm a first year at University of Maryland Capital Region, and come with me, I'm going to show you around. We're going to go to the second floor. The second floor has the ED, the PACU, all that good stuff. Here we have our trauma bay to the left, and on the right is where we can go into our emergency department. Here's our ED, where we have 2 separate areas, same rooms. We have a physician's fishbowl area, we have resuscitation rooms, and we have family meeting rooms. So this is what all of our ED rooms look like. Very spacious. They all have a computer as well as monitor and even a TV. So this is our area where we have all things surgical. We have pre-op rooms, we have PACU, we have operating rooms. We also have 2 endoscopy suites, 2 state-of-the-art cath labs, 1 EP suite, and 1 IR suite. Come with me. Now let's go to the fourth floor where most of the residents hang out, eat. We get conference room lectures there. Let's go. On the fourth floor, you can also find our physician work lounge where we have computers. You'll also find our physician lounge. So this is our conference room where we have all of our noon conferences and morning reports. On the sixth floor, we have the CVC unit where we keep all of our cardiac patients. We see a wide variety of cardiac procedures on this floor. We see thoracic surgery patients on this floor, as well as patients that have cardiac STEMIs. That marks the end of the tour of the hospital, the brand new hospital. Thank you so much for coming and hope to see you next July. Bye.